Hello, wherever you are in this beautiful world. Dr. Mark Pasquale here, Adjusted Chiropractic, bringing you some latest, nice, very exciting research. I just wanted to show you and bring you through this today. This is an exciting case that was published quite recently in January this year on asthma in a 38-year-old female undergoing chiropractic care, and how she responded with regards to that care and how she was able to take care of a lot of the issues she was having with regards to asthma, allergies. She was also having another couple of health issues, but like all cases, putting the body in a state where it can heal well, regulate well, is what chiropractic is all about. So I just wanted to bring you through this research article. I'll just share it with you, and also have the link so that you can actually go to it and have a read of it yourself if you want to. So, resolution of allergic asthma in a 38-year-old female undergoing chiropractic care for vertebral subluxation, a case study and review of literature. The review of literature is quite remarkable because in there we find many, many cases which support the mechanisms of having a good working nervous system means that our body should be functioning well and it can respond quite well. So this was published in the Annals of the Vertebral Subluxation Research, and it reported on a patient suffering with allergy-induced asthma, and reveals that chiropractic may play an important role in helping people with asthma. The literature review included and supports the role of chiropractic in those suffering from this health challenge, and calls for more research in this area. We definitely need more research in this area, don't we? Absolutely fantastic results. And so let's go through some of the findings. First of all, numerous case studies and some clinical studies are revealing that there is a relationship between abnormalities in the spine, the nervous system, and the various problems related to asthma and allergies. So this was stated as in the research paper. These types of structural shifts in the spine can cause obstruction of the nerve in the respiratory and immune systems. By correcting structural shifts, chiropractic helps reduce the obstruction. One of the things that is important in this case, and in many cases as well, is that when we actually do have issues or health issues that our body is trying to deal with, one of the things we want to establish is it getting over something? You know, is it healing? Is it regulating itself better? Because if not, what we need to be checking is how well the regulating systems are working, how well the nervous system is working. And why chiropractors pay particular attention to the spine is because the nervous system within the spine is not working well. If there are issues with how the spine is normally functioning, well, then that can cause issues with the nervous system. And if the nervous system isn't working well, then you cause problems with control mechanisms of how the body should work. So, also stated in the article too, with everything we know about the relationship between the nervous system and the immune systems, chiropractic makes perfect sense in the case of asthma. In fact, chiropractic is not treating the asthma or immune dysfunction, but re-establishing normal neurological function, which benefits the respiratory and immune system of the patient. I think that's really concise and very valuable information, that chiropractic is not about actually treating the systems themselves. It's not actually about treating the symptoms themselves. Like if we have asthma or we have a headache or we have back pain or something, it doesn't actually treat that. What it does is it actually allows the nervous system to work correctly and allows the body to be controlled and coordinated correctly, so that whatever's going on tended to by the healing and regulating ability of the body's own self-healing and regulating mechanisms. You know, that's so different to other systems where it's like, okay, you have this, so take that. Okay, you have this sort of problem, so everyone who has that problem needs to take this. Everyone is individual, and everyone's system heals differently and works differently. So as we go on, there is an intimate connection between the function of the respiratory, immune, and nervous system. The immune system has even been described as a continuation of the nervous system. How amazing. With immune cells functioning as the effector cells of the nervous system, and it alerts and guides the immune system, helped along by numerous factors such as neurotransmitters and cytokines. The immune system is such a complex complex system, how it actually functions is quite amazing. So this close association of the two systems has long been acknowledged in chiropractic as an underlying feature of why people improve under chiropractic care for various problems. So the patient reported in this study, as we've said before, was a 38-year-old female with allergy-induced asthma, which she had suffered since she was very young, since she was a teenager. She also had a history of allergies, chronic sinus issues, headaches, and right leg numbness. So the body was dealing with a few things at the same time. Chiropractor examined her, found structural shifts in her neck, mid-back and lower back. She had decreased range of motion, tenderness, and muscle imbalance in her neck, mid-back, lower back, and also sacrum. These structural shifts can lead to obstruction of the nerves, and it is this obstruction called vertebral subluxation that chiropractors correct. Following chiropractic care, she reported resolution of her asthma and her headaches, leg numbness, and sinus issues also improved. I looked into the article, and the time frames of her care was she was under care for 6 months, which is pretty good healing time. And during that 6-month time, she had 2 progress assessments just to assess how well she was progressing and how well she was improving over that time. So the study's author called for additional research to investigate clinical implications of chiropractic care with those with similar symptomatology or those with similar problems. So there you go, amazing research there, just released this month. Journal article, January 2003, actually came out on January 3rd. So that was they've been quite busy over the New Year period, haven't they? So this is something to you can have a look at it. I'll put the links on the research article, but I think in a nutshell, I think the importance of it is that the nervous system is working well, our body gets a chance to work well. So, and if the nervous system is not working well, well, then the body has to fend for itself, and sometimes things can go really astray. So, if anyone needs or has any questions or needs any help with regards to any health concerns that they have, would like an assessment, if anything's going on that's been happening for far too long and it needs to be taken care of, we're here to help. Here at Adjusted Family Chiropractic, just give us a call and we'll see what needs to be done for you. Okay, have a good day, everybody. Take care of yourself. Bye-bye.